Hey guys, welcome back. Today's video is going to be a lot different than what I normally post. This is going to be pertaining to my upcoming surgery. You'll have to excuse clearing my throat or if I need to get a tissue or whatever. And for those of you that are getting ready to have these surgeries, I know you get it. I know you get it. So let's start with a quick introduction. My name is Melanie. I am almost 56 years old. I've never really suffered from chronic allergies or anything like that. I've never had many respiratory allergies. I have been so fortunate as I was a smoker for almost 30 years and was able to successfully quit. It has been close to 12 years since I have smoked a cigarette or had any form of nicotine. So yay, best thing I ever did. I'm here to I wanted to give you a background because it's important, because a lot of you may be asking, well, why are you having these million surgeries and what brought you to the doctor? What sent you to the ear, nose, and throat? So let's do some background. And the surgery I'm getting ready to have is going to be, I've got some notes because I'll never remember. I suffer from an autoimmune disorder that, anyway, sometimes I lose my place or whatever, so I like to keep notes to keep me straight. That, in the name of my surgery, is about this big. I will have those surgeries in the title and the description, but as I've been doing my research, 90% of these videos are done in 3 parts, so even though it's going to make for a long video, I'm going to try my best to do this in one video, including my recovery days, which may just be me popping in and telling you how I'm recovering, like pain scale 1 to 10, what I'm dealing with, how I'm resolving that, tips, tricks, you know, the whole 9 yards. So, all right, about a year and a half ago, I came down with a terrible respiratory infection, like all in my head. Sinus infection, just like pain, pressure, ears crackling, sore throat, whole 9 yards, just a head cold. And it was a head cold that didn't go away. And it was much worse than any other head cold I had ever had, or at least that I could remember. It seemed to lighten up, but then like 4 days later, it was like I was right in the trenches again. Like it never got better. It was the weirdest thing. I got really well for a few days, and then it hit me like a ton of bricks. I'm stuffed up again. Nose won't stop running. Can't stop sneezing. My throat is just so sore because, of course, I'm breathing out of my mouth. And then I was hospitalized for a heart issue, unrelated. So now a period of, this is like 3 months, because we had to take care of the very serious heart issue first. So now that I'm done with all of that, I'm still suffering with this head thing. And my doctor's like, okay, well, let's try another round of antibiotics and steroids. Maybe you should go get some nasal spray. So I did that. Again, it started to alleviate the symptoms. I went ahead and started taking Claritin, 24-hour Claritin. And because I'm new to all of this, like hay fever type symptoms, I was like, I have no idea what's happening. So I was taking Claritin, and I seemed to kind of get better. But then like a week later, crash and burn. I'm right back to square one. It's like, it's as if I never got better. Like I am full blown. And it was so weird because it's not like a normal cold where like one day you're kind of like, well, I feel a little tired and achy. And then the next day you're like, man, yeah, my throat's tickling a little bit. Maybe you start sneezing. This was like going from 0 to 60 in 1 second. I mean, I would go to bed at night with just a little kind of drippy nose, wake up in the morning, throat so sore I can't swallow, nose stuffed up, pressure in my, it was crazy. And I went through this for like 6 months. I'm like, look, this will be my 3rd round of antibiotics within like a 8-month period. I really want to explore other options. So he's like, let's do a CT scan. He did the CT scan, and what he found was this entire side of my face was completely full, like my sinuses completely full. And he said it looked like I had a lot of, I think he called it chronic sinusitis. He said that everything looked really swollen and enlarged, and the CT also showed that I had a polyp, or a couple of polyps, if you will. So I went to the ear, nose, and throat. He couldn't get a camera up either side, neither side. So he said that the deviated septum, if I do this, maybe you could, let's do a close-up. I know you love this. But if you're here because of noses. So let's look at before. You can see the side. right? So as you can see, the deviated septum kind of curves this way. But what's happening is it's curving so much that it's kind of blocking here. I have a whole bunch of things wrong with my nose, and I had no idea. I'm actually nasally now, and I know if you don't know me, you don't know, but constant drainage, it's terrible. I am having a bilateral maxillary antrostomy with removal of tissue from the sinus. So basically, I've had chronic sinusitis so much now, and the inflammation is so bad that it's blocking some of my sinus cavity. I'm having left frontal sinusostomy septoplasty. Okay. So basically what they're going to be doing is they're going to be fixing this, the cartilage right here. So basically what happens is you have a piece of cartilage that holds your nose up because your bone stops about here, right? So you have this piece of cartilage, and then it has two kind of like little flaps, and it can become, well, not become deviated. If you have a deviated septum, you've had it your whole life, but there are conditions that can make it worse, significantly worse. So they've got to straighten out the septum, right, to allow some airflow. But what they discovered is that I have some bone spurs on this side, which are completely closing off some of the sinus here. I'm having bilateral inferior turbinate reduction left and a right polyectomy. And so they're going to reduce, they're not going to eliminate it, they're just going to reduce it a little bit. I already expressed my concerns on what you see in a lot of videos, which is empty nose syndrome. I mean, there's always a risk when you have surgery, but I know that I can't live like I'm living right now. That's impossible. It's gotten so bad now that I constantly feel like I'm coming down with something. Like I don't feel good at all. I watched about 100 videos, no kidding, of people talking about why you have all of these surgeries and the risks and the pros and the cons and everything else. But I've also collected a lot of really good information from multiple YouTubers or people that chose to video their journey. I've gotten some really good tips. So let me take you into the bathroom and we will talk about how I am preparing for surgery. What kind of tips have I collected from the hundreds of videos I've watched? What am I doing for survival, like post-op? Like what are the things I'm doing? All right, so we're in the bathroom. This is a sinus rinse kit, but my doctor does not want me to use this because of the type of surgery I'm having. I'm going to have splints in my nose for a week, a whole 7 days. So he doesn't want me to use this until the splints are removed. But he does want me to use a nasal mist. And I have these three just because they were the least expensive options. The one thing you do have to do is make sure you read the instructions, because there were some of these that had eucalyptus and other things in it with fragrance, like one with lavender. I don't know that that's going to bother the incision site. So I chose the one that was just a saline mist. Now this is HibaCleanse. It was actually given to me by the hospital. I did my pre-op yesterday. I will have to wash from the neck down, avoid sensitive private places. But from the neck down on Saturday, Sunday, and Monday morning. What this does is it gets any infection, if you have an open wound, if there's a chance that you've been exposed to MRSA or staph or anything like that. It's just to help cleanse your body and disinfect, if you will, so that you don't transfer any of that infection. Now, one of the things that the YouTubers that I've watched complain of is an extremely dry mouth, which means extremely dry lips, because your nose is going to be completely plugged and you're not going to be able to breathe out of it. So you're going to be breathing out of your mouth. I also got this dry mouth gel. Please be careful if you have animals, because this does have, let me see what the name of that is again. I forgot what it is. Glycerin, oh, sorbitol and xylitol. So the xylitol, if you look down at the ingredients, the xylitol can be extremely dangerous to pets. It can be deadly. So you're going to want to make sure that you keep this up. All of the mouth rinses that are specifically for dry mouth that have this stuff in it, they are going to have the xylitol, which means you'll need to keep them up if you have animals. I have this, which I have used throughout this whole journey. This stuff is great. It's a nasal gel. It's if your nose starts getting a little bit sore, dry and crusty around the edges, whatever. And then, of course, it's a saline gel, so it's going to help the healing process, you know, on anything that's happening exterior. I actually had some, but I went and bought another thing because this was a lifesaver during some of my more severe sinus issues. All right, unfortunately, I do use a CPAP. I do have sleep apnea. I have both obstructive apnea, which this surgical procedure is going to help, but I have central apnea, which is just the brain delivering signals to breathe. So just like a baby sometimes forgets to breathe, sometimes I stop breathing. It's a very inconvenient fact about me. So I will not be able to use this CPAP machine for the whole process until they take the splints out. He said 7 to 10 days. But the reason I have you in here is because I have an adjustable bed. You will be sitting up, so you need to make sure you have a travel neck pillow. But because my bed is automatic, I can actually bring this up to a seated position. I don't really need that, but I will have a pillow on each side of me so that if I fall asleep, I don't roll over. Hopefully I don't. Sitting up is going to help the healing and prevent a lot of excessive bleeding. And the one thing you didn't see was that I've ordered a humidifier. So, like I said, most of the videos, out of the 100 videos I've watched, have all complained of a dry mouth. So, my humidifier, the reason you're not seeing it here is because it will not be here until Monday, which is the day of my surgery. My husband will be able to set it up. It'll be at the front door by the time we get home from the hospital. Make sure that you have some distilled water because that's what you put in a humidifier to keep calcium buildup and from corroding the parts. So these are just things to think about. You're going to want to drink a lot of fluid. Keep yourself well hydrated before the process, but they want you to stop eating and stop drinking anything at midnight before your procedure. If your procedure is super early in the morning, they might have you cut it off earlier than that. So check with them. But for me, my surgery is scheduled at 10:30 in the morning. They told me stop eating anything at midnight. So I'm just not going to eat before I go to bed. You know what I'm saying? It's fine. Everything's going to be fine. They did tell me that I was allowed to shower in the morning because they want me to use the disinfectant, the biotin soap, right? But they also said, you know, if you want to brush your teeth or whatever, and they said when you take your medication, but just no more than 8 ounces of water, because there are a lot of people out there that are super sensitive to anesthesia and it can cause nausea and vomiting. So the less you have in your stomach, the less likely you are to vomit and then cause a whole kind of problems. But okay, that's all. That's how I got to where I am right now. That's what I have pre-op. And then, of course, I will see you on surgery day. Thanks for watching. I'm going to do my best to timestamp like what I'm talking about in the description below. All right, that's all I have for now. I'll see you on surgery day. All right, this is fresh home from the hospital, and I couldn't talk. I'll let you know why in the next portion. All right, guys, I'm checking in. I am 24 hours post-surgery. And honestly, that little tiny pink little bit of blood is all the blood that I have today. I put a new bandage on this morning after my first saline spray. I did not post yesterday because my surgery didn't get over till after 1:30. We have an hour drive from the hospital, so by the time we got home at 5 and filled prescriptions and just got comfortable in bed, you know, it was pretty late and I was exhausted. So far, the worst experience I've had was the nausea, the extreme nausea from the anesthesia, but they gave me a second dose of whatever that anti-nausea medicine is, which kind of took care of that. But I still was only able to eat a yogurt yesterday. That's all I was able to eat. And that was just so I could take some pain medicine last night. The most uncomfortable thing has been, so far, trying to sleep sitting up. That's not fun. As far as the pain and everything here, you can see my face is irritated from the medical tape and the gauze. You know, you can see it's really raw. But based on this tiny tinge of blood on this, I probably won't have to wear gauze after tomorrow. So this is only temporary. I can feel the stitches pulling in the front corner of my nose. My nose is tender to touch, but honestly, it just feels like I'm super congested. But listen to this. Even with splints in my nose, I can still breathe out of my nose. I'm just choosing not to because I don't want to dry everything up in there. That shiny glow that you're seeing is actually, it's a saline gel. It helps everything heal up. The other pain that I'm feeling is my front 2 teeth. right here feels super sensitive, like I mean electrified sensitive, like nerve pain sensitive. I can't really move my upper lip a lot or wiggle my nose or anything like that. That also hurts. But on a scale of 1 to 10, and I hate to do this because I know everybody has their own pain threshold, I have a pretty high pain threshold. I'm going to say the pain's about a 6.5. Last night was probably a 7. I'm not going to lie. You probably heard some moaning coming from the bedroom last night, and it wasn't the fun kind. It was not the fun kind. Just the pressure. So I'm pushing lots of fluids, eating soft, cold foods or room temperature. I can't eat anything hot because of the sensitivity of my teeth right now. But from what I understand, that's super normal when you have sinus surgery for your teeth to hurt the next day. Honestly, I'd have to say my teeth hurt. My front 2 teeth hurt worse than my sinuses do right now. Starting tomorrow, I can take a shower, just not get my face under hot water. The temperature of the water can't be like steamy hot. Because they're afraid if there's something in there stopping bleeding and I loosen it up, it'll start the bleeding again. I'm probably going to be able to keep the sling off, except for at night when I'm sleeping. Still going to be sleeping sitting up tonight and tomorrow night, and then I'll start slowly taking the bed back. That'll be nice. Oh, I had some difficulty with my throat from the tube. So basically, it feels like I have to clear my throat. It's not painful. It's uncomfortable. It's not painful, though. But other than that, guys, I am really feeling so super blessed. I'm feeling like the prayers have worked because I prayed for minimal pain. I prayed for a quick recovery. And so far, all of that is happening. So I'm super excited about that. Other than that, I'll check in tomorrow. I'll let you know where I'm at. Any new symptoms that you might need to know. But I know that this can get bad for some people. My husband had this done, and he did not have the same outcome that I did post-surgery. His post-surgery was terrifying, and that's why I was so terrified. And now I'm like, if this is the worst it gets, I am feeling super lucky. So, gonna be a little uncomfortable for a week until they take the splints out and the majority of the healing has started. But other than that, I mean, I'm feeling blessed, guys. Super blessed. Thank you for the prayers. Of course, you won't see this until it's completely posted. I'll post tomorrow and let you know where I'm at, and then any updates as necessary during the process, and then I probably won't actually post this video until they take the splints out, and maybe one day past that. But other than that, I think it's just small things here and there that are going to change. I don't think there's going to be much major changes after day 7 or 8. You know what I'm saying? Okay, so it is day 3 of my healing from sinus surgery, and I am not feeling good today. So basically, it just feels like I have this horrible sinus infection, real headache, mostly right in here. Just, I don't feel good. And of course, even though my nose has stopped running and I no longer have to wear tape on my face, I'm just not feeling good. It's not horribly painful, but it's uncomfortable. Lots of pressure. I just want to sleep, basically. I'm trying to get off of the pain medication and just switch to like a Tylenol. I was told not to take any Advil or ibuprofen or anything like that. So I just don't want to, take something super, super strong unless I absolutely need it, because they only give you a couple of pills when you leave the hospital. So I definitely want to make sure I have it at night to help me sleep. And then during the day, I'll just tolerate what I can with the Tylenol. So let's talk about what's changed from yesterday. So yesterday, I still had nose bleeding. Today, I don't. I mean, when I do my saline rinses, yes, there's still blood in there, some blood clots. But I'm not doing an irrigation. I'm only doing the saline mist. But there hasn't been any substantial bleeding. I am very, very sore. I'm very aware that there's stitches inside my nose. And I have a horrible sinus type headache. My teeth don't hurt as bad as they did yesterday, but they still are very sensitive.
to hot and cold. I just feel achy. I feel extremely tired and my eyes hurt. So I came out here to sit, kind of change of location, but to be honest with you, I'm probably going to be back in bed soon. I'm not in terrible pain. I'm just not feeling good today. If there's any other things that happened today that I need to update you or come to mind to tell you about, I will update you. But for now, we are just beginning day 3 and I am feeling very uncomfortable.
Welcome to this train wreck. It is day 4 post-surgery. Still can't smile. Any kind of stretching here or curling of the nose pulls on this stitch right behind this nostril. So I still have a lot of swelling, tender to the touch. I still feel a lot of facial pressure, but it's not as bad as it has been. I do feel like it's letting up a little bit. I feel a little bit more energy this morning, and I don't know if that's because I got a better night's sleep. So last night being the 3rd night, and for 2 nights I haven't bled at all from my nose. So I was able to take my head down a little bit further in the bed. I have an adjustable bed. So I was able to lay a little flatter. I was more comfortable. I have 1 hydrocodone left. And you might think that's weird, but they only gave me 10 leaving the hospital. Of course, I took, 1 my first day. That was the most pain. The second day was kind of off and on kind of pain. So I've been sparingly using those and then using Tylenol in between to supplement. Only because I was told no Advil, no NSAIDs, I think is what they call them, NSAID. So I've been just taking Tylenol, acetaminophen. So where am I at today? I feel like I'm healing. I feel like I'm getting better. My energy level's up a little bit. I'm in pain, but not as bad. It's definitely more tolerable. Probably from a 5.5, 6 yesterday to a 3.5 consistently, 4. So it's like, I'm sorry. The one thing that you will have to deal with is a runny nose. Like my nose, especially if you're doing the saline mist, sometimes little pockets of mist get trapped up there and then, So I usually keep a tissue on me, but, I'm doing the video, so why would I have a tissue on me? Because, it's much better for an entire audience of people to see my nose just drip endlessly. But if I have to deal with it, you have to deal with it. I'm sorry, I can't smile. It hurts. Okay. My teeth are not as painful, but they're still very sensitive to hot and cold. My front 2 teeth specifically, and then the little flap of skin behind my front 2 teeth. It feels like when the doctor gives you Novocaine, but the Novocaine's kind of almost wore off, but it still has that dead nerve feeling. It's so weird, just that little spot right behind those 2 teeth feels weird. But we'll see if that comes back. So I was able to sleep better. Last night I took 1 hydrocodone, but then the rest of the night I did wake up at 1:30 with a very bad headache. That's been my biggest thing, is the sinus headache. It feels like I have a horrible sinus infection. So I took some Tylenol. It seemed to take it away, and it's now 6:30 a.m. So it's been like 5 hours and the headache has not come back, so it's sporadic. So I'm feeling pretty hopeful today. I'm going to try to get a couple loads of laundry done. However, I'm not going to go into public. Only because I could probably go grocery shopping, except for the fact that I'm very aware that I have open wounds in my nose, and as I breathe, and people sneeze, or people have, communicable diseases, contagious things, or whatever, I would be real susceptible with my immune system taking a hit, with me having open wounds, I would be super susceptible to catching something. And I don't need a cold on top of this. So I'm just kind of doing a self-quarantine thing. I'm not being crazy germaphobe, but I mean, I do have open wounds in my nose. So hubby says he's going to go shopping. He has been such a wonderful godsend during this whole thing, because I tend to be someone that it's like, okay, surgery's over now, back to work, and so he's kept me grounded. He caught me taking the trash cans down to the road yesterday. He got really mad. So he's like, no, you're supposed to be resting. You're not supposed to be lifting. You're not supposed to be extending, But, that's just me and him. And I love him. He's been so great. But so starting today, I'm back to super clean eating. I have been very lazy. I've been very messy in my nutrition. Lots of snack foods, highly processed foods, takeout foods. My husband and I, like I said, have just been in survival mode. So starting today, I'm going back to super strict, super clean paleo eating. The healthier I feed my body, the more it will reward me with quicker healing. So I know that. I know that for a fact. So back to super clean eating today, and then I'll slowly start focusing on weight loss again. Right now, I don't really care about weight loss. I'm just trying to survive this moment.
Good morning. It is day 5 post-recovery. And I'm going to try not to make this long today, but one thing that I thought about to tell you today was I have indoor cats. I have an indoor cat litter box. I completely surrendered that chore to my husband 2 days before the surgery and did a neti pot to make sure that there was no dust or anything like that from the cat litter. I definitely, if you have cats and you don't have someone to help you change the litter, you are going to have open wounds all in your sinus cavity. So my recommendation to you is, at the minimum, wear a mask, but see if you can get someone to help you for a week or two until the majority of the healing is done. You don't want that kind of debris in your nose. All right, so as far as the pain, I'm uncomfortable. It feels like a really bad sinus infection, but I took my last hydrocodone last night. I was able to lay the bed completely down last night. I got a 4-hour stretch of sleep. I think that's the first time I have slept through 4 hours since the procedure, so I am feeling a little more rested today. I am feeling some uncomfortable right here in the arch of my eyeball socket. I'm not a doctor, so I'm feeling a little bit of pressure here, like uncomfortable. Not enough to be like, oh, woe is me, the sky is falling, but enough to be like, wow, this just kind of sucks. So the Tylenol is taking care of the mild pain. I find that coffee helps with that morning headache, because in the morning it's really bad. But I think 2 things are happening. I think while I'm sleeping, because I am naturally a nose breather, I can breathe through my nose. It's a little difficult, but I think what's happening is I'm naturally inclined to breathe through my nose, so I think a lot of that dry air is hitting some of those healing and super sensitive spots. What I have found helps me is I literally just loosely lay a cloth over my face. My humidity from my own breath creates like a more moisturizing situation. And we're not talking about long term. We're only talking about for the right now. When my mouth starts getting super dry, I'll just pull the sheet like here and breathe. And it does help me to sleep a little bit longer before I need to get up and then re-moisten my mouth, take a drink of water, or whatever the case may be. The lip moisturizer has been a lifesaver through this whole thing. As a matter of fact, I'm so in love with this brand that I'm going to switch from my old school. I mean, I've used the same brand, 2 brands of lip balm my whole life. Chapstick and, oh geez, it was just in my head. Carmex. And I found O'Keefe's. I think that's the letter O and then Keefs, maybe? I don't know. It's, what is that? Is that not Italian? What am I saying? Irish. It's like a O'Keefe.
And this stuff has been, I can put it on in the morning and I can have coffee and I can have water, whatever, and I can still feel a protective barrier on my lips. And I think that that's been the one reason that my lips have stayed well moisturized. I haven't had any cracking or drying or anything like that, which would add to the discomfort. So I believe personally that keeping a lip moisturizer on every time you take a drink of water, like, is going to really help you with some possible skin drying issues. I also know that certain pain medications can cause dry, itchy, flaky skin. So I have tried to stay moisturized this whole time, but I've tried to stay away from anything with perfumes or heavily scented or anything like that. The O'Keeffe's that I'm using does have a mild mint scent, but I can't smell it. So, okay, so I slept better. The pain is a little less mild, but still equally irritating. I can't wait to get these splints out of my nose, but I am on the countdown, baby. I'm on the countdown. Today's Saturday morning, so Sunday, Monday, Tuesday, right? I got 3 more days to deal with this, and I think it's all going to be rainbows and unicorns from that point forward. If I had to compare this temporary 1 week of, moderate to first couple days, pretty bad discomfort, to the rest of my life, I'll take the surgery all day, every day. Everything's going to be fine. Everything's going to be okay. Everything's all right.
All right. Welcome to day 6 post sinus surgery recovery. And last night was my first night without pain medication, just Tylenol. That's all I took. I did go to bed sometime around 10:30-ish. I woke up around 2 o'clock, maybe 2:15, with a slight headache. And, it's pressure, but I wouldn't call it pain. This morning I had a mucus explosion. Something happened. I don't know if it was maybe the packing that they put in there. I was told that they use a packing that turns to gel and it helps to keep the bleeding at a minimum. This morning I had it was a mess. I literally had to irrigate my nose with the saline just because there was just so much. You can probably hear it today. I feel stuffy. I have a runny nose. I don't have a fever or anything like that. And the mucus is, for the most part, it's either clear or has a tinge of blood in it, but I'm not like bleeding or anything. Just irritated, I guess. As the swelling of my nose comes down, the stitches, oh gosh, I wish you could see this. I have 2 stitches in this nostril, one that keeps poking me right here, and the other one keeps poking me right here, which constantly makes me sneeze, makes my nose itch, makes my eyes water. It's a whole mess, but I don't want to mess with those stitches. But as the swelling comes down, the tubes are definitely more noticeable in my nose. And like I said, I have now been well over 24 hours without any kind of heavy pain medicine, prescription pain medicine. Everything has just been Tylenol. Today I was able to smell a little bit, like I'm chewing gum right now, and I was able to smell the watermelon, not just taste it. I'm still not able to breathe really well, and when I do that, there is some discomfort and pain back in this area. I really wouldn't even call it pain. It's like a burning sensation. So I'm not doing a lot of that. I want to blow my nose so bad. I just want to clear it all out. But I know I'm not supposed to do that. I'm counting down the days, and I have today, all day today, which today is halfway over. And then I have tomorrow, a full day to go through. And then my appointment's at like 9 o'clock on Tuesday morning. So I will be so ready Tuesday. Now, I don't know if the doctor's going to let me video the extraction of the tube things, but I'll try to get some pictures either way. And I'll definitely give you an update before and after on that. But that's all I really have. I am like, the mucus is super thick today. It's like really stringy gel type thickness. And not a lot of bleeding, a little bit of tender. It's uncomfortable. There's some pressure there. But and a slight headache from time to time. But nothing Tylenol isn't taking care of for me. So there's that. Other than that, nothing else has changed. Same old still.
Sorry about all the stuff in the way. But yeah, I never thought about the recovery of sinus surgery and the fact that you're not supposed to bend over. You're supposed to keep your head above your heart for several days. So let me tell you, these grabbers here have been a lifesaver. So if you're getting ready to have the surgery or you're thinking about the surgery, you might want to grab one of these. These have been fantastic for everything. So yeah, it's been a real lifesaver because I'm on day 7. It has been 1 week since my surgery. I still suffer from some pressure in my head, and when I bend over, it causes a severe headache. So yeah, these have been a lifesaver. I didn't know what I didn't know till I knew, right? So now you know. All right, I'll see you tomorrow. We're getting the splints taken out. Yes! Good morning. It is day 8 post-surgery. I have had no really good sleep. So there's a couple things going on. Number one, the congestion up here is so real. So real. The irritation of the splints, it's not painful. I don't want to use the word pain. I'm not in pain. I'm uncomfortable, right? Which makes everything uncomfortable. Doing anything with your face is uncomfortable. And it's been 8 days now. I've been walking around with these big, thick plastic things shoved up my nose. So I'm kind of at a point where I'm over it. So I had some thoughts about sleep apnea in this process. So I mentioned in the beginning I had sleep apnea. And one of the two biggest things with sleep apnea for me is that I stop breathing and I jerk myself awake. Like I startle myself. And my husband has said that the last 2 nights the snoring has been intense. And it's off and on all night. So I'm sure I'm not getting good restful sleep. I also have become used to having very warm, moist air through a mask being delivered so that, number one, I don't stop breathing, but number 2, to keep the humidity, everything in here good. And I have been breathing just strictly out of my mouth now for 8 days. So waking up with the super dry mouth, I keep bottled water by the bed. I use chapstick before I go to bed. I do all of the things, but you're still, after breathing out of your mouth, you're going to wake up with the dry. And that's got what I have to say. The stints and the dry mouth, the splints and the dry mouth are probably the worst out of everything. Other than day 3 and 4, pretty flipping uncomfortable as far as pain goes. But other than that, I'm just ready to get this over with. But I wanted to make those mental notes about the sleep apnea thing. I'm not sleeping with my machine, so I'm not sleeping well. I definitely notice a difference not having my CPAP.
All right, so here's the before, and get ready for the reveal. This is today. Look at that. She's got nostrils. Okay, let's see if we can wrap this up. Hey guys, you've been with me a whole hour of your life, and I know 60 minutes is a long time, so man, but I also know that if you're watching this whole video, you probably have the surgery or someone you love is having the surgery in the near future. So I'm going to do my best to summarize, just like bullet point summarize. And I realize that your circumstances financially, employment-wise might be different. So if I give a piece of advice that doesn't work in your life, I mean, that's between you and your doctor to kind of figure that out. And I am so sorry that things are a little more hard for you, you know, as far as that goes. I mean, this was expensive for me. Even with insurance, out of pocket, I ended up at almost $3,000 out of pocket. And that doesn't include the follow-up appointment that I have to go to in 4 weeks, but we'll get to that. So they took the stents out, as you can see. I have nostrils. I have nostrils. So it was a little uncomfortable. One of the stitches, he was having, I guess, a hard time cutting under the knot. And I mean, like, it was to the point where I was like, hey, dude, ow, you know, but it wasn't like not enough to bring tears to my eyes or anything like that. It was a little, there was a few moments, and when I say moments, I mean seconds, where I was like, oh, okay, that didn't feel good. But as soon as the splints were removed, the stitches are gone. And after he got done taking that little vacuum, which he couldn't even get the camera up my nose when this all started, right? So he put that vacuum up there. And all of that pressure, I kept telling you throughout this healing process, it feels like pain behind my eyeballs. instantaneously I could feel this back here just decongest. Like, it was insane, and you could hear it too. The machine was like, it was struggling to take down those boogers. I'm just saying. It was messy. It was gross. And he told me that that was the packing that's supposed to gel up like that, because when he pulled the splint out of this side, I mean, I literally could have just, like, it was the endless booger. Like, I'm like, he gave me a little tiny tissue, and I'm like, what am I supposed to do with this? And I got a string of snot from here to here. So, yeah, it was a little bit embarrassing, but it's all part of it. Okay, so the first thing I noticed, the first breath actually kind of hurt a little bit. It has been over 2 years since I have been able to take an unobstructed breath through my nose. And it was like, it was free. I can't explain to you the sensation of being able to breathe successfully, like after struggling to breathe for 2 years, right? It was crazy. It was so crazy. I almost cried in my car, not because I was in pain or anything, but just because I was like, but then it gets better. So things that I didn't even think about. So I love to sing, and I don't claim to be a professional singer. That's not my inspiration. I sing all to lift up and glorify the Lord. And, you know, so I had my favorite radio station going, and I'm singing a song, and I'm like, my voice is so different. I was like, holy cow. I'm like singing in a whole key higher. Like, what is happening? And I was all up in there. I was all up in some Hillsong worship, singing the high notes, right? But it was so weird because it almost felt like too much oxygen. You know what I'm saying? It was like, oh, that's so much air. Like, so, yeah, there's things like smiling. You know, I couldn't do this before I got the stitches taken out. It was like magic. As soon as he took the stitches and splints out, it's like, oh, my lip moves now without excruciating pain. So that has been my experience, and I'm going to summarize it all. So before your surgery date, you're going to want to take some time off. And I know I was a single mom for 12 years, right? I was a single mom. I know. But I'm going to tell you, the day of surgery, you're not going to be able to work. The day after surgery, you're going to feel beat up. And unless your job involves just simply copying data from one place to another, you are going to be on some pain medications. You might be able to handle just Tylenol for the pain, but you're going to be on some kind of pain medication. And, you know, if your job is requiring absolute accuracy, I don't know that I would do that on pain meds, but if you had to ask my honest opinion, I would say you're going to need at least 4 days off of work. And maybe you can't take 4 days off of work. But maybe you can work with your surgeon, your doctor, to schedule your surgery 2 days before you have 2 days off. That way you're only missing 2 days instead of 4. I would recommend the full 5, just because by the time the anesthesia left my body, day 3 was really rough. Day 4, because you're not going to be sleeping well at night. That's one of the discomforts of recovery. You are only going to sleep for about 2 hours, maybe 3 at a time if you're taking pain meds. You are going to wake up with a dry mouth, and you're going to be drinking, which also means you're going to be peeing. Symptoms of this procedure are not bad on their own, but like if you're trying to work a job, it could be difficult. I hope you have someone to help you. My husband was just a fantastic help to me, and because he has gone through this procedure and had a very bad experience, it was so nice that I didn't run into half the problems he ran into. But 90% of his problems came because he had an adverse reaction to the anesthesia, which led to projectile vomiting, and then of course that broke stitches, and like then he was dehydrated. It took my husband 3 full days before we could even take bandages off of his face. Like, we were changing bandages. It was a terrible experience. So, you know, and anytime you have anesthesia, you can have that reaction. So, all right, make sure you've taken enough time. Make sure you have plenty of liquids. If anything, just push fluids. It's going to help keep everything moist. Follow your doctor's instructions. As far as the healing goes, we're all different. And if you're having a different procedure than I have, you may not relate to some of the symptoms that I told you that I dealt with. But my most uncomfortable was sitting up for 3 days. That was horrible, but it's necessary to help with the bleeding. The second was the dry mouth, constant dry mouth. It wasn't until I hit day 3 that I had pain, surgical pain, you know. In my opinion, I still needed something a little heavier than Tylenol, right? Okay, so let's see. How did I make it through all of this? Get a really good chapstick, drink lots of fluids, rest when you can, try to get someone to help you when you can, take the full time off that they recommend, which is 5 to 7 days. Take the full time off, and just know that the results for me are worth it, because I had so much lost. You know what I'm saying? So I've heard other people do these vlogs and say, oh, it was so terrible. Look, it's not pleasant. It's not going to be pleasant. That would be like me saying, hey, look, I'm going to run over your foot with my bicycle, and you expecting that not to hurt. They're in there cutting your nose. They're grinding bone because it's going to hurt. But as far as the pain, nothing compared to pacemaker surgery, nothing compared to gallbladder surgery. I had what I think is a great experience. It was uncomfortable, but well worth it. I mean, come on, guys. Right? And I got my singing voice. Right? Going a little higher. Well, hey, if you're getting ready to have this surgery, comment below. I am a woman of God, and I love Jesus Christ as my Lord and Savior. I would love the opportunity to pray for you. Make sure if you have some strange name on your YouTube channel, that you at least tell me what day you're having the surgery, and I can lift you up in prayer. Please let me do that for you. And I hope that you have minimal effects like I did, and I hope that you heal quickly like I am, and I hope you have the amazing results I have. But I believe that all of that has happened for me because of God, and I laid this journey at His feet. Thank you guys for watching. Thanks for hanging out with me. If you have any questions, I will do my best to get back to you. But that has been my sinus surgery journey, and starting next week, I'll get back to my regular weight loss vlog, journal, whatever, once a week vlog, letting you know how I'm doing with low carb, keto, and carnivore nutrition. That's all I got for you right now. Stay blessed.